Living with rheumatoid arthritis can take a big toll on your mental and emotional health. Addressing this can be an important part of your overall RA treatment plan. We ask a group of people living with RA to share their experiences with this. These are the perspectives of other patients. This is not medical advice and should not take the place of professional medical care.
Getting that diagnosis of RA, especially for me at the time, I was 22, just married, just had my first child, was still in school, and RA brought my life to a halt. I really struggled the first 5 years of my RA, both mentally and physically.
Every time there's a new diagnosis and a new change in medicine or even a new change in lifestyle or whatever, it brings along a period of grief, a period of loss.
There's just a whole gamut of things that people don't understand, and you feel like you're in a bubble by yourself. And that can lead to some depression.
If you don't look like something is wrong with you, a lot of people forget.
What are some of the ways you take care of your mental and emotional health?
I actually sought out help and talked to a therapist about what I was going through, around the medications, around the side effects, around the multiple surgeries that I've had, around the stigma, everything that comes with RA.
I too have seen a therapist, went through a couple of years of counseling. It really helped.
I think everybody needs therapy, but I think it helps you because, again, a lot of people don't realize how taxing it is on you emotionally and physically, especially the people in your home.
Once I found a physician that got me the right treatment options and literally got my life back, my attitude with RA has changed. And yes, we still have those periods where, you may be down for a few days or something like that. But I think the greatest thing I've gotten out of the RA is it's made me a very tenacious person.
To give yourself compassion is the most important thing. Accepting when you just don't have it in you that day is a big deal.
I've sort of figured out things you can do along with the medication to just make things even better. And so for me, mental health is a big thing. And so mindfulness, for sure, meditation, I meditate every day.
I try to maintain a healthy measure of denial about my condition. Some days you wake up and you feel like you don't have RA. And I try to wake up every day and feel like that and look like that. And of course, all of us who have RA know that that's just not the reality of every day of your life. Those days are almost a celebration.
If we tend to focus on the disease and what we've had taken away from us, or yes, this is going to be a disease that I deal with for my whole life. I could be disabled one day, all of that, but I just choose not to focus on it and to help others. And I definitely rely on my family and friends to help within the support system when I am having a harder time.
I came across a quote that I have held hard onto for nearly the entire 9-year plus that I've been in since diagnosis. With acceptance comes peace.
There's a lot to do with the mental too. And for me, that's doing things I love and finding joy in small things in order to alleviate some of that stress, because I do believe that RA and stress, they go hand in hand.
Stress, anxiety, depression, and other issues can affect many people living with rheumatoid arthritis. You are not alone. Let your provider know what you're going through so you can discuss treatment options. Caring for your mental and emotional health, whether with medication, therapy, or stress relieving practices, is an important part of treating your RA.